Really, there was a recognition that there was a need for a dedicated area with state-of-the-art equipment that could support clinical research in Northern Ireland.
Research is central to the mission of Belfast Health and Social Care Trust. It's very important to us that our patients can get access to new treatments as soon as they become available.
And one of the difficulties we have in doing research into rare diseases is that there can be very small numbers of patients worldwide. The patients on the trial that I'm working on have until recently been travelling to London on a weekly basis. As you can imagine, this is quite a considerable burden of travel.
I think the thing was, that because you were on the treatment, you knew it was doing you good, so you did, but you're on a placebo for 6 months, so the 6 months you were travelling that you might not even have been getting the drug. It was so that their results and data wouldn't be affected. And then with all the travelling, it was that hard to tell, what way you were actually feeling, because you were pretty sore and tired anyway, You're not getting any time off or anything, you just had to keep going. So it was hard to tell what the drug was actually doing for you. So now I'm only getting it in a day and able to tell, how it's benefiting me a lot more,
And what we're going to see is more and more patients enrolling into clinical trials, wanting to be part of tomorrow's treatments, wanting to learn more about their diseases. We're already seeing that in our clinics, where patients are becoming more partners in understanding the disease process, and indeed in actually defining how we actually go about treating diseases.
When patients arrive at the Northern Ireland Clinical Research Facility, they'll be hosted by a team of dedicated Nicrf nurses who are trained to take them through the research protocols we have in place for the study. Each individual will go round a series of tests and measurements whereby we can assess their personal health and well-being. The Nicrf study is the Northern Ireland Cohort Longitudinal Study of Ageing. It's a research study set up by the Centre for Public Health in Queen's University, Belfast. And the purpose of Nicrf is to study the health of people over 50 as they progress through ageing and into retirement in Northern Ireland. And by having a purpose-built centre such as this, which is specialist for research needs and provides us with up-to-date equipment and a dedicated facility, means that people will be familiar with where they have to come and visit to meet our research nurses on a 4-yearly basis.
In developing the clinical research facility, we've worked very closely both with Queen's University and the University of Ulster. This is a facility for the whole of the north of Ireland. We're very, very grateful to the Wellcome Trust and the Wolfson Foundation for the funding they have provided, which has enabled us to develop this space. It's a big investment which will bring real benefit to our patients, and the development wouldn't have taken place without their support.
This facility allows us a more clinical focus to our research, and not only that, but it is based in a prime location, being within the highest population density within Northern Ireland. We've been fully engaged in this partnership since the beginning, and we intend to do so in the future. Indeed, my colleague, Dr. Mary Ward, is Deputy Director of the facility.
So our facility includes 10 rooms with piped oxygen and suction, and the rooms are equipped with couches, beds, chairs and a television. We have stadiometers, vital signs and phlebotomy equipment. We also have a kitchen available for nutrition studies, a sample processing laboratory, reception area and a general office. We have full details of the equipment on our website. Some examples are equipment in vision research and Optus and ocular response analyzer. For nutrition research, we have a DEXA scanner, a body stat and a stadiometer.
The other aspect to the clinical research facility will be that it will provide great opportunities for doctors, nurses and indeed other health professionals, physiotherapists, occupational therapists, nutritionists, to actually be engaged in training programs that augment their skill sets.
One of the really important aims of the clinical research facility is to take our findings from the laboratory and bring it to research that actually helps develop new treatments for patients and brings the benefits of research to improve patient care.
Any new developments that happen within those research centres are actually going to be tried out here first. And those could be new treatments, new ways of diagnosing disease, or they may actually highlight things that we need to be doing to prevent disease within our population.
Clinical research needs to take place in a safe environment, and this provides such a space. The work here will be conducted to the very highest ethical and safety standards under the supervision of the Belfast Trust Research Office. New treatments are being developed all the time by researchers based within the Trust and both local universities, and those treatments need to move from the bench through to the bedside where patients can get real benefit. We hope that the work we do here will benefit both our patients and patients in hospitals elsewhere throughout the UK and Ireland and the world.